In today's health alert, tuberculosis cases have hit record highs, with over 8 million people infected worldwide last year. The World Health Organization says this is the highest number they've tracked for the disease. So for more on this, our chief health editor, Dr. Partha Nandi, joining us. And Dr. Nandi, are deaths rising too? And what's behind the spread?
Yeah, not good news here, right? So according to the 2024 Global Tuberculosis Report, Glenda, around 1.25 million, that's right, million people worldwide died from tuberculosis, or TB as we call it for short. And this was just last year. This is tough to see, especially since TB is a disease that I feel like we can prevent, detect, and treat. So what's behind the rise, right? Well, there are 5 major risk factors, which are undernutrition, HIV infection, alcohol use disorders, smoking, and diabetes. Of those who developed TB, 55% were men, 33% women, and 12% were actually children and teens, unfortunately. Now, TB can also spread easily, especially in crowded places. And this disease is caused by a bacteria called Mycobacterium tuberculosis. When symptoms are present, a person has what's called active tuberculosis or active TB, and is contagious. They can spread the disease through coughing, sneezing, or even singing. There's also latent tuberculosis. That means the bacteria is inactive but living inside the body. You don't have to have any symptoms and are not contagious, but you could get sick in the future and need to take medicine to prevent this from happening.
So is this a concern in the U.S., and how do you know if you have it?
Important question, right? So the U.S. still has one of the lowest rates of TB in the world, Glenda, but it's still a concern here. In 2022, there were just over 8,300 reported cases, and it's estimated that up to 13 million people in the U.S. are living with latent TB infection. Now, TB mainly affects the lungs, but can also attack other areas like the kidney, spine, and brain. If you have active TB, symptoms depend on where it's growing, and general symptoms include these: chills, fevers, night sweats, weight loss, loss of appetite, and feeling that fatigue. If TB is in the lungs, symptoms might include a cough lasting more than 3 weeks, coughing up blood, or thick mucus and chest pain. Hey, if you think you have TB, talk to your doctor, as there's a skin test or a blood test. If treatment is needed, there are specific antibodies that can be prescribed, and they're successful. It's worth mentioning that drug-resistant TB is still a challenge for some places, especially for folks with weakened immune systems. But there is good news in the report, right? TB deaths are continuing to decline globally, and new infections are starting to level off. While there is a lot to be done, I'm optimistic that increased awareness can really help with diagnosis and save more lives. And I think we're going to get there.
All right. Hope we do. Thank you so much, Doctor. Appreciate that.
Of course.
If you have a health question for the good doctor, you can email him, Dr. Nandi, at AskDrNandi.com, or send it to us on Facebook or X. We'll get it right to him.